Every month, I see at least one patient who did great during surgery, and at 1 week I see them and I think, wait, what happened? Surgery went great, but at their 1 week follow-up, they look like they went 10 rounds in the ring with Tyson. Here's the thing. There is definitely some element of luck for how you heal after eyelid surgery, but there are some avoidable problems that you can control. Knowing what not to do is honestly more than half the battle here. And you might be surprised to find out that I think you should do what everyone online tells you not to do after surgery. So stay tuned for that. I'm Dr. Kian Eftekari. I'm an oculofacial plastic surgeon and I exclusively perform eyelid surgery. This is the video I wish every one of my patients watched a couple of days or even a week before their procedure. We're gonna go through some mistakes that can derail an otherwise smooth recovery. And please stick around to the end. The last one on this list is a mistake that can turn a normal routine eyelid surgery recovery into a genuine emergency. That one I don't want you to miss. Okay, the first no-no after eyelid surgery, don't skip the ice. Ice in the first 48 to 72 hours is not just for comfort, it is actively trying to prevent swelling. The protocol, at least for me, is 15 minutes on, once an hour while you're awake. You might need to rotate an ice pack with a bag of frozen peas, that way you keep them cold. That's all you gotta do. You know how after you sprain your ankle, the first thing that anyone tells you is just to ice it? Same principle here. You're trying to slow the accumulation of fluid in the tissue right in that first window after surgery when you actually have some control over it. Every patient I've had who's skipped the ice, they've had a lot more bruising and a longer recovery. Not fun, and it's not a coincidence. The takeaway, ice is the cheapest tool you have to control how your first week looks. Don't skip it. And one important note, don't ice overnight. Now, if you were sent home with lid lift goggles after surgery, you can wear those continuously for the first 3 to 4 hours after surgery. Then you want to shoot for about 80% of the time for those first 3 days. You can wear those overnight for the first night or two if you want. That's going to give you the best chance of limiting your bruising. It's actually better than ice. Okay, the next no-no, do not sleep in an easy chair. This is one I hear a lot online. You should sleep in a chair overnight after surgery. Okay, speaking from somebody who cannot sleep on a plane, like not at all, hear me on this. Your sleep quality, sitting up in a chair, is terrible. Don't do that. But there is some truth behind this. Swelling follows gravity. That's not a metaphor, it's just physiology. If you do the opposite of sleeping in the chair, if you sleep totally flat those first 3 days, swelling is gonna pool in your face overnight, and then you'll wake up looking significantly worse than you did before you went to bed. So here's what I tell everyone if you can. Think of your face like the way you think of a swollen ankle. What do you do with a swollen ankle? You prop it up above your heart. Your face needs the same thing after surgery. Sleep in your bed, but try to add an extra pillow, get your head above your heart. But please don't do the I'm gonna sleep in an easy chair thing unless you want to. It's definitely not what I would want for you. Okay, here's the next no-no. Don't take the wrong things. Here's one that catches most people off guard. The most common way that my patients accidentally mess up their recovery is not skipping the ice or sleeping wrong. It's something sitting in their medicine cabinet. Blood thinners are the enemy of a clean recovery. Now there's some obvious ones like aspirin, but there are also some that are not so obvious, like alcohol. Hear me on this. Alcohol, the night before surgery, is a bad idea. You might be nervous, you just want to relax, take an edge off, get that glass of wine or that glass of scotch. This causes some of the worst bleeding that I see during surgery. Here's the thing, alcohol actually impairs your body's ability to clot, which can mean more bleeding into the tissues, more bruising, and a longer recovery. Alcohol is the one that nobody thinks about, but the most common ones, aspirin, ibuprofen, Advil, Motrin, even fish oil if you're able to avoid that. Now, let's just say you're having a headache a week before surgery. What do? Tylenol, plain old Tylenol. That's the secret. I know that sounds boring, and most people tell me, Tylenol doesn't work for me. But Tylenol doesn't thin the blood. Tylenol is so magical that I give it to every single one of my patients right before surgery because studies have shown it is powerful at reducing pain afterwards. My opinion, the Tylenol people, they didn't do so great on branding. They had some issues in the 80s, but trust me, Tylenol works. So before surgery, not after, before, go through your full medication and supplement list. Everything counts. The takeaway from this, the danger isn't the pill that you know that you're taking, it's the one that you don't realize might actually be thinning your blood. Okay, I want to be real with you about something for a second. Most of my patients feel better faster than they expected. And honestly, that's the dangerous part. Feeling okay at day 3 doesn't mean that everything is healed. The healing that's actually happening, the stuff underneath that you can't see, that can take a few weeks. Think about like a freshly painted wall. It looks completely dry to the touch after an hour, but if you put some furniture against it, you're gonna do some damage. Sometimes that damage is irreversible. Same thing is going on under your eyelid skin. And that is why this next one is so important. The next no-no, don't power lift at the gym. Okay, this is the #1 question I get from my patients and the #1 source of confusion. When can I go to the gym after eyelid surgery? And my answer might surprise you. I think you should go to the gym. I think it's actually beneficial. There's a lot of misconceptions about this, and it's a little complicated, so let me try to simplify it. One big disclaimer though, check with your individual surgeon first. Okay, so this is why it's complicated. If you had surgery around your eyes and you're my patient, the answer is gonna be a little different than if you had a lower face surgery like a facelift, so keep that in mind. If you had eyelid surgery, you can go to the gym, you can. But what you do at the gym is way more important than any normal week. Here's why going to the gym can be bad. When you go to the gym, if you're like me, you want to get the most out of your time there. So you push yourself, maybe sometimes a little harder than you should. And pushing yourself to that failure rep or that one last move that gets one more in is going to be the rep that could mess up your surgery. I've seen this before. People tell me they get to the gym or they work out a little too early after surgery and they heard a pop around one of their stitches. Don't be one of those patients. But here's the thing. I think you should go to the gym. I think you should exercise. And this is why. After surgery, your body has been under anesthesia in a lot of cases, and that can temporarily throw off your circulation, just like being on a 10-hour flight is a risk for getting a blood clot. Going to the gym, going for a walk, going for a hike, that can get your heart rate up. That's gonna circulate blood flow throughout your body. And that is a great thing after surgery if you just break a little sweat, but you have to stop there. You don't want to do something called Valsalva. Valsalva is when you hold your breath as you lift up a weight. Think, that can bump up your bruising and swelling and push your recovery back, can even pop a stitch. If you don't want to go to the gym, walking is great. Walk your dog, take a stroll around the neighborhood. You want your legs to pump that blood back through your circulation and help you heal. Just make sure you've got some nice big Liz Taylor glasses on for that walk around the neighborhood. The takeaway from this, don't avoid the gym or avoid getting your heart rate up. Just try to be smart about it. Okay, the next no-no, don't submerge the eye area. No swimming, no hot tubs, no submerging in the bath. Now showering can be okay after surgery, it just kind of depends on the surgery. Now if you've got your face wrapped up, then maybe you want to just do neck down, but talk to your surgeon around that. If you're showering, just keep your head back, keep your face out of the direct stream, let the water come down from above. It is okay to get wet though. However, hot tubs are not sterile environments. Introducing bacteria to a healing incision, not good. Same basic story with pools. Even with chlorine, you've got bacterial exposure, you've got submersion pressure. As with any of these, just double check with your individual surgeon before you do anything like this. Next no-no. This is big. Don't ignore the warning signs. Okay, this is the one I saved for the end. Everything else on this list will set your recovery back. This one's a little different. This complication that I'm about to describe is rare. Please hear me on that. We're talking somewhere in the range of 1 in 10,000 to 1 in 20,000 surgeries. But it's the one complication that can cause permanent vision loss if it isn't caught and treated immediately. This is called a retrobulbar hematoma. That is bleeding behind the eye. Here's what you want to know. Now first, it might depend on what kind of surgery you had. It's a little bit more common after lower eyelid fat surgery than upper eyelid surgery. Sometimes what can happen is that after surgery, there can be some bleeding around and behind the eye. Not bruising, bleeding. Now here's why that's a problem. The eye socket, small, tight space, 30 milliliters. That's like a small little bottle that you have in your medicine cabinet. Now if you have bleeding in this small tight space of the eye socket, that's called a hematoma, and it fills up that space. Filling that space affects the optic nerve. So what's the optic nerve? The optic nerve is the cable that takes the information you get in your eye back to your brain, and that gives you vision. Filling the eye socket space means that the blood flow to your optic nerve can get cut off. That is an emergency. So how do you know if you're having this and if you need to call your surgeon or go to the ER? Okay, so after eyelid surgery, your eye is going to be swollen and a little bit hard to open. Key word, little bit. That's normal, that's expected. What is not normal is if you genuinely cannot open your eyes. Not hard to open, I'm talking impossible. Literally what I mean by this is if you stick your fingers at the corner of your eyelids and you try to pry your eyelids open, you can't do it. They don't open. This can sometimes be associated with severe pain behind the eye, nausea, or a steep drop in your vision. You got all these things together, you need to call your surgeon right away and just start heading towards the ER. Let me tell you this is super rare. I wanna make that clear. But if I can help one person avoid this problem, all my time that I put into education will have been worth it. Because that 1 in 20,000 is worth saving. So let's review this. Here's the test that I walk every patient through. If you can open your eye at all, even just a half crack, even just with some effort, you almost certainly do not have a hematoma. If you cannot open it, and your spouse or significant other can't open it either, and you've got significant pain behind the eye, or nauseated, or your vision is doing something weird, call your surgeon. Not a text, not a message through their app, phone call right now. Don't wait until morning and start going to the ER. The window for treating this is narrow, but please don't let this scare you from surgery. This is so rare and it's treatable if it's caught. I'm telling you this because I feel that information is what protects you. The takeaway from this, can't open your eye, even with your fingers, nausea, pain, vision loss, call right away. All right, I promised a bonus tip and I'll warn you, this one's not glamorous, but it might be the single most practical thing on this list. The number one thing that will help you feel better after surgery, friggin' eye drops. The biggest barrier to them? You, like me, are a human being and you just forget. The thing about eye drops is they don't really work if you get behind the 8 ball, if your eyes get dry before you start using them. If you can stay ahead of it and keep the eyes moisturized, they're gonna feel better. So here's my tip. Take your cell phone, set an alarm for eye drops. I know that sounds stupid, but I'm talking like preservative-free artificial tears every 2 hours just for the first few days. Sometimes you might need them for the first few weeks, but trying to stay ahead of it those first 2 days can really make a difference. And then you want to put antibiotic ointment where your surgeon tells you on the incisions at nighttime. Sometimes, and honestly this is what I would do if I had eyelid surgery, if you're having a lot of eye pain and dryness, put some of the ointment into the eye. Watch this video on putting drops and ointment in to learn exactly how. The biggest compliance problem I see with this is not because people didn't know or didn't care about their eyes, it's just genuinely hard to do the eye drops. You get distracted, you looked up and 3 hours have gone by and now your eyes are dry and irritated and you're stuck behind that 8 ball. So set a timer every couple hours the first few days. Now, is it boring? Yes. Does it work? Yes, it does. So here's the honest summary. The vast majority of eyelid surgery recoveries go really smoothly. And if you've watched this whole video, you're in much better shape than most people going in because you know the rules and more importantly, you know the reasons. That's what actually makes people follow them. If you have surgery coming up, drop your surgery date in the comments. If you're recovering, I wish you well and I hope this helps. I do read the comments and there's something genuinely useful about the community of people going through the same thing at the same time. If you want to learn the right technique for applying eye drops after surgery, and there is a technique, it matters more than you think, check out that video I mentioned that's linked above. And if you're in the research phase, trying to just figure out if eyelid surgery is right for you, check out our surgery on the 5 signs that you actually might need eyelid surgery. Our consultation link is in the description, eyelid.pro/book. Thanks for watching. I'll see you in the next one.